in my life.
Hey guys, welcome to another video of Clamatics. Hope you're all doing well. Today I'm heading to geriatrics ward and we will be learning about cannulation with Dr. Ikra.
When we're doing a cannulation, we need to first set up our equipment. So we need a tourniquet, we need an alcohol wipe, we need some flush, and you need some gauze as well. And you have a choice of cannulation needles. So there's usually three, but I don't see the third one here. You have a blue one and a pink one, and there's a green one. The blue is the smallest, pink is second, and green is largest. Usually they ask for pink or green when you're doing procedures like CT with the contrast. But for older people, the best ones are the blue ones because they're the smallest. Usually get the tourniquet like you're doing blood, and you try and basically go for the hand usually, because it's more uncomfortable for the patient to have it on their arm or in the cubital fossa region. So we try to go for the hand. Once you can see, it's quite a few good veins here. So I usually will like tap on the vein to get them up. And you'll see that that vein's quite straight. So you're looking for a straight vein that's not very tortuous and is quite bouncy to touch. And you take the needle, and when you take it out, I'll show you. What I usually do is I get the wings and I flatten out the wings, because this is where we're going to kind of secure it on later. And I hold on to the needle like this whilst pulling off this part. So when we're going in, we're going to go in this way. And once we're in, you'll see the flashback come here.
Yeah, red.
Yeah, you'll see red. And then you start to pull out the needle. So I usually hold it like this. And when I see the flashback, I will start to pull it out like that.
Right.
And you'll start to see the blood come through this little tubing here.
Yeah, okay.
Until you take it out completely. And this part you usually dispose. But when you've got that in, you have to be careful because the blood will come rushing out. What you can do is, this is a trick I've learned here, is you can occlude the vein. And you shouldn't get so much blood coming through. But this is why we have gauze as well. You can put it underneath just to not make as much mess. Once you're in, you usually have to first test it out with some flush. So you'll screw off this and you'll like squirt out a little bit, and then you'll screw it on here and squirt it inside. And you're checking for any kind of enlargements, and you're asking the patient if they're feeling any pain. It might be a bit cold, but usually it should go in without any resistance, and it should be fine. And once that's done, you usually get this little white stopper, and you can just stop it on the end here, like that, and that will stay in the vein. And then to secure it, we have these little bandage stickers things. So what I usually do is, when we open that, this is how it looks like. So these things usually stick it down. So you take it and you put it down on the little wings. So we put it on the wings. I'll show on myself because it'll work better. So I'll have it down like this. The next thing I do is I usually take off the middle part. I just find it easier later. Just take off the middle part first. There, that's done. And what you'll do is you will put it on like this.
Right.
Usually that's inside the vein. And this is clear because you're trying to see the vein where it's been inserted. And then after that, you just take off the rest. And then you get the little sticker, label the date. And then you put it on there, or there, whatever you want to put it. And then it's done. It's finished. But sometimes there are patients, so in elderly medicine, you have a lot of dementia patients, and what they'll do is they'll pull out their cannula. So what I would usually do with those patients,
We make like a sandwich. Like
So-
one of the doctors told me to say that. Sandwich bandage.
So you get basically a bandage and you just bandage it around and so
Right.
they don't pull it out.
Yeah, one of the doctors told me that, you know, the way you put it this way here,
Yeah.
just take another one and put it like this way.
Yeah. Some
So-
people do it twice. Yeah.
Yeah.
That's another way of doing it
Mm-hmm.
as well, just to secure it. But just to be sure, you always take a bandage for these patients so it
Right.
doesn't come out.
Mm-hmm.
And then
Right.
that's it.
Thank you.
It's okay.